Welcome to the channel Nursing in Handy. This channel is preferably for the nursing fraternities to have a continuous learning in a profession. This video will be useful for the nursing aspirants who are preparing for their nursing officer examinations, any competitive examinations. So today we are going to see in detail about the competitive exam questionnaires with the rationale. And today we have taken from the subject gynecology and obstetric nursing. Already have uploaded 3 videos related to the competitive exam questionnaires, and today we will be seeing about the gynecology and obstetric nursing. If you find this video to be useful, kindly like it, share it and subscribe it, and let's get started. First question is, X-ray study of the fallopian tube is known as. So each and every organ, they have a medical terminology. So we should know, before preparing for any examination, we should know that words, so that it will be easy for us to rule out from the 4 options and we can omit which is not related to the questionnaires. So we'll see the options. Option A, salpingography. Option B, myelography. Option C, cholecystoscopy. And option D, pylography. So can you guess what is the answer is? Yes, the answer is option A, salpingography. So we should know what is the other options are. So myelography means it is the imaging test. It is scan to examine the spinal cord and other structure. That is known as myelography. Cholecystoscopy is to visualize the gallbladder functions and their anatomy. And pylography means it is used to examine the kidney, ureter and bladder. So from this questions, it is very clear that X-ray of the fallopian tube is salpingography. This salpingography is done by giving a radio opaque contrast medium, and they do the visualization of the ureter mainly during the to rule out the patency of the tubes. So next question is, the drug of choice of induction of ovulation is. So among this 4 option, which is going to be the ovulation stimulant? So option A, clomiphene. Option B, ethinyl estradiol. Option C, danazole. And option D, levonorgestrel. So among these 4 options, the answer is clomiphene citrate. The action of the clomiphene citrate, it is a ovulation stimulant. Okay, it is going to stimulate the ovulation. Whereas the other option like ethinyl estradiol, it is a contraceptive. It prevents the ovulation. Okay. So the option C, danazole, it is an androgenic hormone, and option D, again it is a contraceptive. So the remaining 3 option is not a drug of choice for the induction of ovulation, whereas a clomiphene citrate is a ovulatory stimulant and it is a non-steroidal. It helps to stimulate the ovulation. So other 3 options are not the ovulation stimulant. It is also a very direct question. So sometimes what happens in the examinations, they will ask very direct questions, so that you can answer it very wisely by knowing the answer. So third question is, the drug of choice for the management of gestational diabetes mellitus. So this is a very repeated questions in every examinations. We can see it. So among the 4 options, which is going to be the best drug for the gestational diabetes mellitus? So option A is troglitazone, and option B is glipizide, and option C is metformin, and option D is insulin. So in this question, the drug of choice for the gestational diabetes mellitus they have asked. So in the gestational diabetes mellitus, you have to be very careful while giving the medications to the mothers, because we should see that it does not cross the placenta. So among this, the correct answer is insulin. Other options like troglitazone, glipizide and metformin, it crosses the placenta. So the best option, that is a best drug of choice for the gestational diabetes mellitus is insulin. So let's move on to the 4th questions. So in the 4th question is, what Nake's rule is used to calculate? So what is mean by Nake's rule? So among that 4 options, one is option A, EDD. EDD is expected delivery date. Option B, cervical dilation. Option C, amniotic fluid. And option D is a gestational age. So Nake's rule, it is mainly used to calculate the expected delivery date of the baby. So How you will calculate the next rule? So when a mother comes to the doctor and they will definitely ask this to calculate the expected delivery date of the baby. So what is the formula of that is the first day of the LMP, that is last menstrual period, plus 9 month plus 7 days. So the doctor will be asking, no, like what was your last menstrual period? From that last menstrual period they will add the 9 month plus 7 days. That is the next rule. So the last question is the thickest layer of uteruses. So among these four options, which is going to be the thickest layer of the uteruses? So option A endometrium, option B myometrium, and option C perimetrium, and option D peritoneum. So this is also very direct question. So mainly uterus consists of three layers, that is perimetrium, myometrium and endometrium. So outer layer is known as the perimetrium, middle layer is known as the myometrium, and the inner layer is known as the endometrium. So peritoneum, it is not at all related to the layers of the uterus. So here the answer is the thickest layer of the smooth muscle of the uterus is going to be the myometrium. So the correct option is myometrium. So the myometrium, in which consists of the upper thicker part and the cervical part going to be thinner, and it is joined in the pattern of tree of life. That means it is going to give the pathway for the sperms. That means it gives the passage for the sperms. So the myometrium is the thickest layer. So outer layer perimetrium and inner layer is endometrium. So this is also a very direct question. So the correct option is myometrium. So this is the thickest layer of the smooth muscles. So that's all about the today's questions related to the obstetrics and gynecological nursing. So if you have any doubt, kindly drop down in the comment box, and if you want any other questions or you want me to increase the question numbers, kindly drop down in the comment box. And if you have any queries or constructive criticism is being welcomed. Thank you for watching. Kindly like it, share it and subscribe it.